One of the most common cause for a lot of these exercise injuries that I see people coming in with, a lot of times it's technique. Technique goes off while they're doing a certain exercise, potentially doing something where their body isn't ready and they need to slowly build up to it. There's a whole lot of different things, but those are the most common reasons why people, I find, get injured from exercising. So this is a very basic and simple one, a proper warm-up. I think ever since we were in grade school, we were taught to warm up properly. And what that means is that you don't spend like 2 minutes on the treadmill and that's your warm-up. You want to go into a warm-up that's maybe 15 to 20 minutes in length. It seems unrealistic, but in many cases it's very, very helpful to make sure that the body is fully warm before you go heavily into the exercises. One of the things that tends to get blown off, just like the proper warm-up, is stretching. What you want to do is you want to have a proper stretching routine, and that's not a 5-minute routine, a 2-minute routine. You're looking at about maybe 15-20 minutes of real stretching to make sure that you maintain proper flexibility for yourself. So before you even do any exercise, one of the mistakes that people make is that they load up on the weights without proper technique. What I often tell patients, and when I used to personal train, is that you go with the lightest weight possible and focus on the technique. If you're not sure about that technique, you want to ask a professional to show you exactly how to do the technique. And technique also includes speed. Sometimes what will happen is that you will rush a certain exercise, and when you rush a certain exercise, there's a tendency to get injured. Okay, so core strength is something that I think that kind of gets put to the back burner. So, working on the midsection. It is important because it can help reduce injuries. In fact, there's been some research with college athletes that show that the ones that have weaker core strength tend to get a lot more lower body injuries. So it's not just about the back, protecting the back, it's also decreasing the potential injuries to your lower body and potentially your upper body. In particular, for example, when you're doing a push-up or a plank, if things are unstable around the midsection, there tends to be more forces laid out on your upper body and lower body. One of the common causes of injury is that people tend to rush their intensity of exercises. So for example, one week you might start off with 5 kilometers, all of a sudden the next week you're up to like 20 kilometers. Or another fine example is like you might be bench pressing, say 50 pounds one week, all of a sudden you're up to 80 pounds the next week. It's actually a smarter idea and a wiser idea to incrementally increase the amount of weight or distance or whatever form of intensity that you're doing so that you can maintain your health as opposed to all of a sudden injuring yourself from doing too much. One of the things that I see a lot in the gyms is locking your joints. And what that means is that, like say for example, you're doing an exercise where you're extending your elbow, right? This is just an example because this could be with the knee. You're going to find that some people in the gym will actually lock their joints. So what you want to do is you want to make sure that you stay nice and soft in terms of like when you're extending the joint. So for example, instead of locking the elbow when you're doing a bench press, you can have it slightly bent. So there's a bit of a give there as opposed to sort of locking it and potentially causing an injury to the joint. So a final tip for you is if you're unsure about a certain exercise, if you're starting up with exercise, make sure that you find a professional that can help you with the technique. that is a simple investment, but I think it can help in the long run. So when I'm talking about a professional, I'm just talking about somebody who's got a certification in personal training. My advice to many of my patients is that you want to get somebody who's certified but also has a healthcare background, whether it be chiropractic, physiotherapy, massage therapy, athletic therapy. It's a good idea so that you have more of a base of knowledge to work with. That person has more of a base to work with to help you make sure that your technique is proper.